Good morning, Chris Ohl, Infectious Diseases, Wake Forest Baptist Health. Almost August. Summer is in its last third, which is always the most fun third, I think. The swimming pool becomes less crowded and more refreshing. So, a little bit of an update on COVID. Lots of stuff bouncing around in the media, I think a little bit of a loss of perspective from multiple areas. And so I'm going to try to sort some of that out for people this morning. First of all, what's going on with our case numbers? So across the country, they're going up. It seems like everyone says, oh, it's the Delta variant, it's the Delta variant. But people have to remember it's also a good part of it is that we stopped paying attention to COVID in May. And we dropped all of our distancing and masking, and people are going back to bars, and they're going back to doing what they were doing pre-pandemic, which I don't blame people for doing that. But that actually probably has more of a component to our case rise, all in all, than the Delta variant. The Delta variant is important, though. We're starting to hone in a little bit on how much more infectious it is. It's about 1.8 times more infectious. If you put that on the R0, which is what us people in infectious diseases determine what infectiousness is, it's up there higher than flu, not as high as chickenpox, not as high as measles, not as high as norovirus, that vomiting virus, but albeit higher than the wild type coronavirus we dealt with at the beginning and higher than the Alpha variant. Where does that increased transmission seem to make the most difference is actually in the home, is in the household. And household transmissions now, where it used to be you had about a 20% risk of getting infected from someone in your household, now you have about a 40% chance. So the household is an area that is driving a lot of our increased cases. There are other areas and other places too where Delta variant has taken hold, and some of them, the old fitness center outbreaks are starting to come back and starting to get published. Delta in a fitness center is going to be more of a problem than the old COVID in the fitness center. Some in youth sports, summer camps where people aren't masking and aren't vaccinated. These are areas where outbreaks are starting to occur now. Here in the triad, our cases are going up. And I would put that in a little bit of perspective because now you can get on the web or through your local media and find out whether you need to mask or not map. And that is dependent on what range the CDC declares your area as far as how much transmission is going on in the community. So I'll just parse out Forsyth County just to make it a little simpler. Our transmission here, per the CDC map, is substantial. So what do you have to be substantial? Well, you have to have a percent positivity of your tests above 10%. Ours is 5. And you have to have a case number between 50 and 100 per 100,000 per day over a 7-day rolling average. So ours is about 55 out of a scale of 55 to 100. So by their definition, we're just barely in that substantial range. And that's why we're that color on the map, so you know. So I guess the good news is it's not as bad as it is in a lot of other areas. But our cases are continuing to go up, and I think within a week we'll be firmly in the substantial range. And so we might as well start getting used to that now and being there. It still, though, is about kind of two different types of pandemics. And by far and large, the unvaccinated people are the ones getting most of these infections. In hospitals, for hospitalizations, other than for immunocompromised people who don't really mount vaccine responses very well, especially really profoundly immunocompromised people. The number of vaccinated people getting admitted to our hospitals is so low it's hard to measure. Deaths is basically none. I haven't seen any deaths in our area in a vaccinated person that was directly attributable to COVID in a vaccinated person. But in unvaccinated people, that's who's filling up our hospitals. So are our hospitals in danger of being overwhelmed in the triad? No, not really. Our number of cases are in the realm. We can easily take care of them, but they are going up. And we have more cases this week than last week, and definitely more than June. So we're having to keep an eye on that. The ICU admissions are not nearly what they were back in January and February when we were really in the heat of it with COVID, and that's largely because a lot of our more vulnerable population have been vaccinated. So Delta variant is the strain now. So we can stop saying Delta variant, actually. We can just say COVID, because that is what's circulating in almost all areas now, including here. The other thing that people have been, that is really generating a lot of media attention is so-called vaccine breakthroughs. So I'm gonna walk you through a little bit of science here. And a few science concepts, infectious disease sciences. Just think about this. At the end of the pandemic, if you keep watching my things, you guys will all be certified ID doctors. But so the first bit of science has to do with case baseline bias, which is an epidemiologic term that means that you have to be careful and how you interpret reports, particularly reports from the media. So let's just take one particular one that's been cited a lot and seems to be contributing to a lot of freak out right now. That the Pfizer vaccine, even in fully vaccinated people, is less than 60% effective. That comes out of Israel. And it's based on breakthroughs in vaccinated people in Israel. Okay. So that's a study that unfortunately suffers from baseline bias. So it has to do with this. A vaccinated person getting COVID is not the same thing as measuring a COVID case and then finding out who's vaccinated. So let's take it to the limit and think about it. Let's say you're in an area or a country that's like 98% vaccinated. Israel's not quite that high, but they're pretty darn high. Every case of COVID you're going to see is going to be a breakthrough, right? Because everyone's vaccinated. The denominator in that fraction are only vaccinated people. So if you have 120 cases, it's 100% breakthroughs. If you have a population that's only 2% vaccinated, then everyone's going to be an unvaccinated person. So the only real way to tell those numbers is to do a study looking at both sets of populations and then do some really good statistics in a population-based way, knowing what the bottom of the fraction is. And then you can determine. So the study published last week in the New England Journal, Pfizer's vaccine, 88% effective in preventing symptomatic COVID. That's all symptomatic, including breakthroughs and colds. And it's still way up there for preventing serious disease, hospitalization, and death. So your odds of dying of COVID, if you've been vaccinated per that study, is like 0.00003%. So you're more likely to get struck by lightning, basically. So you have to put breakthroughs in perspective. So when you're watching media, you got to keep that in mind. The other thing is that if you're listening to the media and watching the media now, you would think that everyone who's been vaccinated has either had a breakthrough or is going to have a breakthrough in the next week. So if you look at hospital cohort of patients, even in areas where Delta is circulating, it's about 1 to 5% of our cases right now are breakthrough cases in vaccinated people. So it's really not that high. I wanted to check up on that, so I texted and called my good friend and fantastic ID doctor, Robin Trotman, out in Springfield, Missouri. And we chatted because Springfield, Missouri is the epicenter of the current outbreak across the country. Put it in perspective, they have about 160 people in their hospital with COVID, and they're a 400-bed hospital, and they just had to build a new ICU. So there are a lot of cases out there. So I asked him, how many cases are you seeing in vaccinated people? And he said, it's somewhere between 5 to 8 per day. And this is an area that's seeing probably about 200 per 100,000 per day total cases. So it's about that, somewhere between 1 and 5%. And these cases are cases that he sends home, puts them in quarantine or isolation, but they go home. And then he said a lot of them actually are people who don't have any symptoms at all. And we just picked them up on routine screening testing for things like, coming in the hospital on admission or something like that. So you have to put breakthroughs a little bit in perspective. So in total, what does all this mean? This means the vaccine is working. If you want to look at it in a little bit more of a historical and sociological way, what COVID is transitioning to is a cold. And we are right now at the beginning of that transition. So if you go back a year, COVID was horrible, mortality rate of 4%, hospitalizations galore, a lot of long COVID, and it was a pretty serious disease, so serious that we went into lockdown and did all the things we needed to do. Right now, we're at the beginning of the transition where COVID's going to become a cold. Once it becomes a cold, for almost everyone, for like 95% of the population, then we won't need to isolate anymore. We won't need to quarantine anymore. It'll be a cold. Just another one of those cold viruses. So we're in the beginning of that transition. So that should help us feel it's a little bit good, that in the large sense, that's what's happening. And certainly with breakthroughs, that's what it is. COVID in an unvaccinated person is still serious business, particularly if you have comorbidities. Comorbidity is an underlying illness. Turns out with Delta, it seems like Delta takes advantage of one specific comorbidity, and that's being overweight, particularly if your BMI is over 30% or so. Just something to keep in the back of your mind. But if you're unvaccinated and have a comorbidity, COVID is still serious business. You need to be doing things to protect yourself still. And for vaccinated people, as I said last week, COVID is an annoyance. COVID is a cold, except if you're heavily immunocompromised. I was talking to somebody the other day who was a breakthrough. They got a cold with COVID. And I asked them, how are you feeling? And they said, pretty good. I just ran 3 miles. Okay, so that's COVID in a breakthrough in a vaccinated person. It's a totally different situation. So having said all of these things, you're probably asking, why are we jumping back to masking then? And it has to do with we are trying to figure out what these breakthrough infections, this small number of breakthrough infections, mean for transmission. So it looks like people who have symptomatic breakthrough infections, those small numbers who do, can transmit it to an unvaccinated person, and that their viral loads are high enough to do so. What's a little bit up in the air is that can an asymptomatic person with a positive test transmit it to an unvaccinated person? That seems to be a little bit more up in the air. Though viral loads in the asymptomatics, early data seem to suggest it's lower in the asymptomatics. That question, though, is important because if asymptomatic breakthroughs can transmit, obviously asymptomatic people don't have a big A on their forehead, so you don't know. And so while all this is being sorted out, the recommendations for masks to come back came through. And in a time when case numbers are going up and schools are starting to open, I think it's a good idea. Definitely, if you're immunocompromised or have underlying health problems or at the extremes of age, you should be wearing a mask when vaccinated when going out in public. If you're going into areas where transmission risk could be higher, you should be wearing a mask when you go there in public. And I agree with that. Even if vaccinated, I agree with that right now. And that's why I applaud the school board's decision here in Forsyth County last night to require masks coming back in. Because we got some sorting out to do. We need to know how much transmission is actually occurring from vaccinated people. And because only about 30% of the upper schools in public school in Forsyth County are vaccinated, 70% unvaccinated is too high. And in that situation, if when these kids come back to school, there will be a difference from last spring. Last spring, there was hardly any transmission of COVID in schools. People were wearing the masks and doing other mitigation. If you take the mask off and you go back with Delta around, schools could be a significant engine for transmission, not only within the school, but also for the household that the kids come back to and also for the community. So while we're sorting this out, it makes sense, come back vaccinated. Now there are some schools that are like 90% vaccinated for the kids who can get it. Those might make different decisions because of the milieu surrounding them. So regarding breakthroughs in general, there's two analogies that I want people to understand. And this has to do with, the first one is my Shark Tank analogy. So bear with me on this one. If you've seen Shark Tank on Discovery Channel, then you kind of know what I'm talking about. If you are lowered into a shark tank in a shark cage, and the cage can be considered the vaccine, and the sharks, unvaccinated people with COVID, if you have one or two sharks in your shark tank and you're in a shark cage, you can feel pretty good. Your chance of getting nipped in the rear is pretty darn low by a shark getting through the cage. But if you're lowered with your cage, your vaccine cage, into a shark tank with 200 sharks, your chances of getting nipped in the butt are a lot higher. And so it kind of comes down to, for vaccinated people, the more unvaccinated people who have COVID that you're around, the more likely you're going to get a breakthrough. So if you're surrounded all by vaccinated people, your odds of getting COVID are pretty darn low. And this is particularly important because I told you where is a lot of this transmission occurring now is in the household. So if your crazy cousin Eddie didn't want to get vaccinated and he's living down in the basement, you might want to talk to him because you want to be surrounded by vaccinated people, particularly if you have kids in the house who are under 12 who can't be vaccinated. The other thing is that the data is very early, but my hypothesis, and I believe this is going to get sorted out, that if you get two people unvaccinated together for 15 minutes in close proximity, the odds of one unvaccinated person giving it to an unvaccinated person is pretty high, probably 50-50. If you get an unvaccinated person who has COVID together with a vaccinated person, the risk of that vaccinated person getting a breakthrough is going to come down substantially. It'll happen from time to time, but it'll be unusual. It'll be difficult. If you have a vaccinated person who has a breakthrough, their odds of giving it to an unvaccinated person will be difficult, but possible. if you have a breakthrough in a vaccinated person in contact with another vaccinated person, that's going to be a very unusual event for transmission to occur. So you got to look at the 1, 2, 3, 2, and then how the lines go between that. Told you there'd be a lot of science today. So, anyway, so I think that's where we're at with all of that. Just to reiterate, the mask guidance is out, and what I agree with now, if you're immunocompromised and you're going to go out in public areas amongst people who are unvaccinated, which is going to happen because half of our county is unvaccinated, then you should be wearing a mask. You should be wearing a surgical mask if you're immunocompromised for the better protection for you, and if it doesn't fit real well, put a cloth mask on top and it fits better. If you're not immunocompromised and you're going to an area of transmission risk, if you're going to be indoors, you should be putting a mask on. We want to make sure that asymptomatic breakthroughs don't transmit. We'll know that in a month. And then outside, I don't think you need a mask. So those are nice areas to have some time away from your mask. Just get outside. So I've been asked, so what's the anticipated timeline for full FDA approval and availability for younger kids? So I'm going to take a step back before I answer that question, because there's an important nuance here that a lot of people don't know. And that is, right now, the data is pretty clear that if you have significant and immunocompromising condition, a organ transplant patient on suppressants, or a person with a hematologic malignancy like leukemia, lymphoma, some of these other severe ones, people who are on immunosuppressants for inflammatory bowel disease or rheumatoid arthritis, it's pretty clear that those people don't respond as well to 2 shots of the vaccine, and it's also getting pretty clear that if you get a 3rd shot, or with Johnson & Johnson a 2nd shot, that your antibody levels go way up, and actually early data that your level of protection from getting COVID also goes up. So we really should be giving immunocompromised people a 3-shot series instead of a 2-shot series. So the ACIP looked at this and said, yeah, we agree with that, but because the vaccine is under an EUA and not a full FDA, we cannot comment on when the timing of that 3rd shot should be and what the dose of that 3rd shot should be. And regulatory agencies, such as the FDA, says technically giving a 3rd shot is outside of the EUA, and so we cannot provide information on what the full meaning of that would be. Now, personally, I think getting the 3rd shot is safe and effective, and it'll be fine. In fact, almost everyone does. But we're waiting on FDA approval so that all shot-giving places can open it up. For instance, the health departments and large health systems, because they're following the EUA. If that FDA approval is going to take a while, then the FDA said, well, we'll do another mechanism so people can give the shot outside the EUA, something called an IND, which is a regulatory thing. So I think it's coming down. I think the immunocompromised people will be able to get their 3rd shot pretty soon. I would say within a couple, 3 weeks, actually. I wouldn't be surprised if the full FDA approval doesn't come sometime between now and the first couple weeks of September, actually. By law, they have to give it a thumbs up or a thumbs down by mid-January because they have only so much time from when the application was put in. But it's going to come well before that. And no one anticipates a thumbs down for that. And it'll be a thumbs up. I mean, we have almost 400 million people who've gotten a shot of vaccine in the country now. Not 400 million people, 400 million shots. It's almost 200 million people. So we have a lot of data for the vaccines, and they're good. So what about vaccine mandates? A lot of that in the last couple of weeks, including with our own health system, Wake Forest Baptist Health, as well as Atrium Health, as well as Novant, as well as Moses Cone, as well as Duke, and I could go on and on. Across the country, most of the major health systems have gone with vaccine mandates for their workers. So why do that? The primary reason is in the healthcare setting is to protect patients, because if somebody gets COVID, then they give it to a patient. That's a horrible thing, and it's been extremely rare up until now through the pandemic, because the PPE we use works, but we want it to be even rarer, and so that way when you walk into a hospital to get a hip replacement, you can be assured everyone around you's gotten vaccinated or has an exemption, which is a real reason that they can't get vaccinated. The other reason is to protect themselves, protect the healthcare worker, right? Because, I mean, you're taking care of COVID patients in the hospital, or you're getting exposed at home or out in the community. So in order to preserve our workforce, we do that. And then there's all the other good reasons to get vaccinated too, which we've talked about in the past. But those are the two biggies for the healthcare system. So we do that with a lot of other vaccines. Measles vaccines mandated, mumps mandated, rubella mandated, diphtheria, tetanus mandated, whooping cough mandated, chickenpox mandated, hepatitis B mandated, and did I say chickenpox? Mandated. So we've already been doing that. Flu is mandated in almost all hospitals now too. So it's out there. The COVID vaccines are not experimental. We have very good data. They're well outside of the experiment phase now. And people were worried about, oh, will there be a long-term side effect at some point, 20 years from now? It's extremely unlikely. It's just as likely as you could get it from a new food you bought at the grocery store. I mean, you don't know the future. But it's extremely unlikely. We have a lot of experience with vaccines, and those things don't happen. So that's basically it with mandates. So it's actually leaving the healthcare systems now too. The federal workers mandated. A lot of cities now are mandating it for their workers and their people. Some private workplaces are mandating it. So eventually this is going to become like your measles vaccine, where you're going to have to get it if you want to do anything. Someday, eventually everyone will be on board. So, I've gotten a couple phone calls this week. So, I have my sister in Tennessee refuses to get vaccinated, and she has reasons where she should. She has underlying health problems, but she just won't do it. Nor will her husband. And what can I do to talk to them about it? And there's two things I think that really make a difference for people who are truly hesitant. Somebody who's truly hesitant is somebody who's worried or scared or wants the information or wants it checked out a little bit more, is to have somebody from a trusted source talk to them about it. And so as a physician, their personal physician, somebody they know, somebody in their own family, somebody who maybe in their a clergy, somebody in their social circles, and that works. What works against people who are just simply belligerent? I don't know. And I'll say it again, sort of as my last words here. One way or another, you're going to get immune to COVID. Just about everyone will. And you're going to get it through a vaccine, or you're going to get it the hard way. And the hard way being getting the disease. And depending on your health status, how old you are, you have somewhere between a 1 or 2% chance. 1 or 2 out of 50, so it's about a half to 1%. So 1 or 2 out of 50 people will die getting immune the hard way. And so, I mean, eventually we're all going to get immune. So what does that mean for the community at large? It means we'll get out of the pandemic that way. And all you have to do right now is look at England. England's been dealing with Delta since like April, maybe even March. They started having their big Delta wave at the beginning of June. And it went high. The number of cases per 100,000 in England went almost as high as it did last December and January. A lot of people getting COVID. Number of deaths were low because they have a good number of vaccinated people, but it went high. And then Johnson, the Prime Minister, decided we're going to open things up anyway. You don't need to socially distance. You don't need to, we can open our pubs, we can open our restaurants, open the economy back up, which I agree with, but we'll stay masked. And guess what? Right now, their cases are coming down, 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 down. So their wave, I think by the time it comes down to a low level, is going to be about 2 to 2.5 months long, because it started at the beginning of June. So ours started basically in July. So I think the Delta wave will be easing off for us at the end of September. But we can make that happen quicker, and we can protect you while the Delta wave is here by getting you vaccinated. If you get vaccinated, you can be protected by that wave when that wave comes through. And then when the wave is over, it'll be feeling good for everybody. So with that, are there any questions?
Do you see us, lowering the mask mandates when you're saying that we're done with this wave, or do you see it continuing through winter and fall?
Yeah, no, I think it's not going to. Well, that depends how the winter and fall goes. Winter and fall is respiratory viral season, so we'll have to see. But I think that once the wave gets to a point that's really manageable, the CDC would say below substantial transmission in a community, and or the proportion of people in a certain situation get vaccinated. That gets it up around 80-85%. Then the mask can come down.
A couple questions on the.
Yeah, it says COVID vaccines expiring soon. Any info on number of doses expected to expire soon? So yeah, there is a bunch of vaccine that's coming up to expire at the end of August. We would like to get that vaccine into people. That's the best way to use it. And there is some talk about extending the expiration date, but there's a lot of scientific experiments in the lab that have to be done on that first, and I think those are ongoing. So we could see it extended. We do that for a lot of medicines, actually. When they get near expiration dates, the company puts in an application to extend the expiration date. And a lot of these vaccines are kept in such ultra cold places that they likely can go longer than an expiration date that's on there. Because when you think about it, when the vaccine first comes out, right, you put an expiration date on the thing, but you don't really know how long, because you have to go do the ongoing studies. So we'll see how it goes, but it'd be best if we could just get them into people between now and the end of August.
And then there's that second one about, you want to talk about, how it's easier now to.
Yeah, there's certain, so the question is changing regulations on storing vaccines and allow them to last longer. So that's all part of that. People are rethinking what temperature they have to be at, what settings. And because we'd like the vaccines to last as long as they can. But a lot of that information and data right now is still, I think we'll know more in a couple weeks. But yeah, we'd like to do that.
Is there any news on if any of the additional vaccines are going to be made available for the younger?
Oh yeah, when will vaccines be available for kids under 12? Right now it's what 12-year-old and up can get it, but under 12. So Pfizer just said earlier this week, it may even have been yesterday, that they expect to have all their data together by the mid-September. The FDA asked for more people to be enrolled in the pediatric clinical trials. And the reason why they did this is because that increases their number of people they're evaluating for safety signals. And so we want to make sure that the safety signals that we saw for adults that look pretty good, very good, apply to kids too. So both Moderna and Pfizer are going to have to enroll more kids in their trial. And that was just announced a couple weeks ago. So the good news is that there are so many parents out there who are eager to get their kids vaccinated that they're really not anticipated that they'll have problems enrolling these kids in these trials. And so Pfizer still thinks that by mid to late September that they'll have the data together. And then they'll submit that to the FDA, and then it'll get heard, and then there'll be an EUA that'll come out for probably the 5 to 12-year-old group first. And that will probably happen roughly, give or take, 3 weeks on either side of Thanksgiving. So it could be as early as Halloween. Wouldn't that be a great Halloween trick-or-treat?
Is Johnson & Johnson, is there an estimated date from when the 12 to 18-year-olds might be able to get Johnson & Johnson?
Yeah, Johnson & Johnson vaccine for 12 to 18. I haven't heard a date on that. Yeah, I have not heard a date. All right, so we'll see you next week. We're going to move back the time where this starts, for those of you who watch live, from 10 until 10:30, starting next week and then going on from there. So it'll be 10:30 from now on. That'll give Dr. Ohl a chance to get breakfast. So.